So I think while we have CARICOM as the regional organization, I think a lot of times it's driven by the the aspirations of the member state, what member states want. But I think sometimes what we need to look at, because member states would have different wants, and what we have to look at now is perhaps what are the regional things that are common. So, for example, each member state might have different um, EHR, electronic health records. But if we want to move as a region, we have to get all these different electronic health records in different countries talking to each other. In that way, you will have portability of data. So there are many regional things that can be done in health. Digital health is just one example. So I think what we have to start looking for is these opportunities where we can work regionally so that we can bring each other closer. One of the things that came up this morning is that we have capacities in different countries, but they're not adequately utilized. So if, for example, we are able to know, maybe Jamaica, they have capacity to do neurosurgery, and Trinidad has capacity to do pediatric surgery, and somebody else, then we can share that and work out arrangements where these things can be done more effectively, rather than each country trying to build its own capacity. In Guyana, we have various capabilities too that we can share. So, for example, we have a pretty strong program now on kidney transplants. And one of the things has been that when you need to test the organs to see whether there's compatibility, we had to send those tests to Miami, for example. Nobody in the Caribbean is doing the HLA testing. And so transplant programs in the Caribbean would have to send their testing to Miami or somewhere else. We have now developed that capability of doing HLA testing in Guyana. We have had someone trained, came back working in the field. We have all the equipment, so we are testing for our own program. And if there are other programs in the Caribbean that need us to test for them, then we are very much capable of doing that. And so there are many other ways that we can collaborate. I think what you need to do, that's where the role of CARICOM comes in, is to coordinate all of this, see the areas where there's a need, and see where the resources are in the Caribbean, and then match people who need and with those who have. And I think that's how we can work together. So biobanking is, in very simple terms, is collecting maybe tissues and being able to keep it in a repository. And you can have various types of biobanks. So for example, persons with cancer, if you take a sample to do the test to see what type of cancer they have, you can then store the thing rather than throw it away after you finish testing. But if you have large sample sizes, let's say, maybe a couple thousand sample of a particular cancer, there would be people who would want to do research on these samples to see what are the commonalities, what is it that we can learn from these samples. And so that learning can help us to inform new ways of creating diagnostic tools, and also how we can detect these, not just detect these things earlier, but how we can treat these conditions. So in a simple way, that's one way of looking at a biobank. What we also want to do, because we want to, apart from doing that, we'll start with the simple, we also see this as being the future of medicine. So right now, medicine is about a one-size-fits-all. So if you get a tablet, it doesn't consider your biological makeup, your genetics, metabolism, all of that. It doesn't consider that. Because when they ran the clinical trials, they were doing it on a group of people and they feel this dose might be appropriate for a wide group of people. The new way of medicine, or the new direction in which medicine is going, is for it to be more precise. So it is moving from a mass-based way of treating people to precision. So, and you customize it to the individual. And that's where we want to go, which means that we'll have to understand the individual genetic makeup and other parameters of that person. And then you can customize doses that are relevant to that person. So when you do biobanking, you're able to look at all kinds of tests that can come out of this. So there's something called omics. So the proteins that are in a cell, you can measure that, you can look at all kinds of parameters regarding that. The RNA, the DNA, all the enzymes that are within a cell, you can actually decipher all of that. That's a language by itself. And that gives you a lot of information about a person. And you can convert that into making medicines, making diagnoses, all kinds of different things. That's the future. And so what we are trying to do, we start simply with biobanking, but we want to evolve it to this level where we can have the convergence of what we're seeing in biology, match that with computational science, which allows us to make better diagnosis. And when you layer that with AI, it's taking us to the next level because, like one of the presenters this morning, he has been using AI to help him to decide new medicines on what are the active ingredients for new medicines, new conditions, and so forth. And so rather than spending 10, 15 years in developing one particular medicine, that can be shortened to 3 years, 4 years. So you're gaining a lot of time making a precision medicine that can help to alleviate people's condition. So that's where we want to go. That's the future of medicine. And that's why we thought that it's important for people in the Caribbean to start thinking about this, and then we'll see how we can grow this area together. We are starting that in Guyana, and hopefully what we are going to develop and research and do here would be applicable for other people in other parts of the region.
And you're open to sharing with the community?
Definitely, because we see this frontier of medicine, that there can be lots of research, and hopefully we'll also be able to develop new therapeutics. And while we're doing all of that too, while we invest in the research and innovate new drugs, that also can be an income stream for the country.